Mood disorders amongst the elderly is very common. People after retiring may find that they have no purpose in life in some instances and end up doing very simple tasks of just cleaning their house, maybe going for a walk or two, and sometimes feel helpless and useless in society. This is not the case. Some of these symptoms may be mild depression, and depressive illness in the Asian community may be frowned upon, and there's a social stigma associated with mental illness. It would be useful for someone with a mental problem or depressive illness to seek help. Sometimes it may not be medication that they need, but simple reassurance. Some of them suffer from anxiety, sleep difficulties, and occasionally we may pick up one or two patients who have dementia. With this in mind, patients who start losing their powers of memory, fearful that they're forgetting things and unable to perform executive tasks, may need to be seen and investigated in light of dementia. There are a lot of causes of dementia, and dementia is a syndrome. Alzheimer's disease, vascular dementia, Lewy body dementia, and so forth. These are all subcategories of dementia. To have a proper investigation, one may need to have a proper history with a doctor, blood tests to make sure that certain things that could be replaced or treated, and also investigations of the brain, whereby having a brain scan would be a very useful tool in looking at the brain structure. Treatment of dementia comes in a role of reassurance to the patient and also with medication. There are lots of things that one can do at home with someone who has a relative, a father, a mother with dementia. Making the home environment comfortable and useful for the patient with regards to its function is very important. They may not be able to tell the time. They may not be able to dress themselves. They may not be able to go to toilet appropriately, and therefore one may need help and certain tools at home to help them with this. People with dementia have problem telling time. Sometimes it's very useful to have a digital clock. The normal clock or the conventional clock at times can be very difficult for a patient with dementia to read because they may have spatial orientation problems, meaning that the time for them may not be going clockwise as we know it. And also reading the time on the clock with the hands may be very confusing. They may have problems with sleeping at night and are awake and wonder and spend most of their morning time asleep, and the patient's relatives may find this very difficult because they have to keep up with the patients when they are awake. Often at times you get patients who are agitated, angry, but unable to express themselves. I'll give you an example of a patient who has been bedbound and restrained because of dementia. And the picture that we're painting there would be a patient who has now lost all dignity, bound to a bed, and only fed when necessary. They've lost total control of their bowel and are predominantly wearing nappy throughout the day. The risk factors of this patient dying is very high due to simple things of immobility, dehydration, and also the use of restraints. The patient may not be able to call out or to wander off, and may even have a fall trying to get out of bed.